The biggest mistake that I see is that clinicians are recommending ready to wear when their patients should really be in a custom made garment for them because the fabric's different. So usually with ready to wear fabric, it's going to be that thinner fabric, right? And what happens with that thinner fabric is we call it circular knit, but it will dig into skin folds and potentially cause a wound. And it's just honestly very uncomfortable. That's definitely going to be more comfortable than something slightly thicker. But it's actually the opposite. For most lymphedema patients, we actually want a very slightly thicker material called flat knit because it bridges skin folds and it also provides that high containment that lymphedema patients require.
The information provided on this podcast for educational purposes only and is no intent nor should be used as a substitute for medical advice. Consult a licensed qualified medical physician for any issues concerning your health. If you would like to know different strategies to improve your quality of life during your cancer journey, this is the podcast for you. Welcome to Taking Charge of My Cancer podcast, where I'll be interviewing different healthcare professionals, cancer survivors, and I'll be teaching you different resources, tips, and solutions so you can get the best outcomes while dealing with a cancer. So welcome back to Taking Charge of My Cancer podcast. And really, today we're going to dive into a topic that blends clinical expertise and real-world impact, helping people live with more comfortable and confidence with lymphedema. I'm your host, and I'm excited to introduce our guest, an experienced occupational therapist who specializes in supporting individuals managing this often misunderstood condition. Through a combination of personal care, patient education, and functional rehabilitation, they help clients regain independence and improve their quality of life. In addition to her clinical work, our colleague collaborates with JOBST, a company known for its innovative compression garments designed to support lymphatic health. Together, they bridge the gap between therapy and technology, ensuring patients not only receive the right treatment, but also the right tools to manage their condition every day. So in this episode, we will explore what lymphedema really is, how occupational therapy plays a critical role in treatment, and how compression solutions can make a meaningful difference in daily living. So let's get started. So I have Jocelyn Blatchley, and she is an occupational therapist original from Melbourne, Florida, and currently living in Tampa. She has been a practice OT for the last 14 years and recently transitioned to a Southeast medical advisor role with JOBST compression garments. She has experience working in acute care, inpatient rehab, outpatient rehab, and home health. She's passionate about lymphedema care and ensuring patients get into the right fit for optimal outcomes. So Jocelyn, thank you so much for being in here with me today.
Thank you, Darlie. I'm so excited to be here.
That's super excited. So can you share your journey from occupational therapy into working with JOBST compression, like how that whole thing happened?
Sure. I have probably worked in almost every part of the healthcare continuum. So I've worked in inpatient rehab, outpatient rehab, home health. I've dabbled in pediatrics, but I really landed on lymphedema and oncology care actually as a caregiver. So my mom was diagnosed with breast cancer. And so I saw kind of the discrepancy in the community from good care to maybe not so great care, therapists that knew how to treat lymphedema to therapists that maybe didn't. And I really kind of glued into that as my passion. So I dove in, I got my CLT certification, my certified lymphedema therapist certification back in probably almost 13 years ago now, and started working in a clinic. And when I came out of certification, I didn't know any other CLTs, or maybe one or two. I had almost no support. And I really built a program from the bottom up as the only therapist
Wow.
in the clinic. Yeah. So that was a really interesting experience. And then after that, I transitioned to a larger hospital system where there was lots of lymphedema therapists on staff, which was also a really interesting transition as well, where I got to learn from a lot of other people and learn how big institutions work. So very different experiences, but very cool experiences in that way. But as a caregiver, and maybe you can understand this, it's tough, right? It is tough to work in healthcare and then also kind of take care of your family members as well, take care of yourself. So I started really soul searching, and I always kind of had a really great experience with my JOBST compression garment support staff. And this position opened up, and it was kind of the right time for me to transition and pivot out of patient care. And just so happened that it was the perfect time for this person leaving this role. And I just got extremely lucky that I'm able to work for such a great company who really values itself in taking care of the patient. So it's a long-winded response
No.
of how I got to where I am today.
Well, something that totally surprised me about this podcast, and is one of the things that I love, is like when you think you know somebody, you really don't know anything about them. So I know we come across each other a few times, and it's all about patient care, right? So it's like you helping me with feeding this person, and what can we do for this patient, and in conference and things like that, and talking about the products, but really never, like I never knew that you
Yeah,
live
you never know.
with breast cancer. So what inspired you from like that clinical care? I know that was the right time and you felt like there was a need for it, but what was the thing that really pivoted from that clinical care into sales, right? An
Yeah.
education role? Because sometimes I feel like a lot of us PTs are not good at sales. Like
Well,
in our training, that's not really
mhm.
something that for the most part, gets a lot of push. Like we are
Yeah.
not really that great on business building. So I think that we're good at selling, like, education in regarding what the patient needs,
Mhm.
and what is important. But when you bring into like selling a product, I don't think we have a lot of a background on it. So what make you really jump into that?
Yeah, so I mean, it wasn't so much leaving patient care as it was the opportunity to expand my impact was really appealing to me. So in the clinic, it was great that I was able to help one patient at a time. But in this role, I'm getting to support so many clinicians across an entire Southeast region, right? So I cover Florida, Louisiana, and Mississippi, and a little bit of Arkansas. So I cover a vast region, right? So I'm indirectly helping hundreds, sometimes thousands of patients that I didn't have that same scope in patient care. And I also just realized how much I really enjoyed problem solving with therapists. So helping them choose the garments, figuring out tricky cases was really appealing to me because I really needed that support as a new lymphedema therapist. Didn't really always know where to turn. So my goal in this role is to be that person that new therapists can call, that seasoned therapists can call when they're in a bind and they don't have anywhere else to go. I want to be that person to be able to pick up the phone and help them. So to me, that relationship building, that love of education and advocacy really kind of all blends together in this role. And that's kind of how I got inspired in this transition.
You want to tell the audience a little bit about what is jobs?
Yeah, so I work for JOBST, which is a subsidiary of Essity. So if you can see my shirt, I have an Essity shirt on today. But Conrad JOBST was really the originator and an innovator of compression garments. So when we talk about the importance of compression garments in oncology care, it sometimes gets overlooked, right? We're not always thinking about lymphedema. We're not always thinking about, the potential side effects of oncology treatment. So when we're talking about Jobst particular, he was an inventor and an originator and innovator, as I said before. So he actually suffered from chronic venous insufficiency. And he decided that he needed some relief from all the pain in his legs and found that the deeper he got into a pool, the better his legs felt. And he wanted to kind of mimic that on land. So he decided to invent gradient compression. And that's kind of where we land today. And the beautiful part of the story is that his wife, Carolyn, kind of took the business and ran with it. So it's a woman run and built company as well, which really speaks to me. But really, when we're talking about JOPES in all aspects of compression care. We cover from the top of your head all the way down to your toes. So we say toes to nose solutions, and we offer everything. So if you're stuck and you don't know where to turn with your compression care, like there's likely a solution that we have for you. As far as trying different items, we have thousands and thousands of SKUs that we're able to try to get the right fit and satisfaction of the patient. So yeah, that's kind of the quick and dirty about JOBST in general.
Okay. So do you think your experience with patients influenced your interest in compression therapy? How did you feel that was a key?
Yeah.
I remember when I became a CLT as well, and I don't know if you knew this, but I've been a PT for many years. I did ortho for many years. And
Oh, okay.
And in the last 17 years, I've been doing oncology.
Mm-hmm.
Initially, you learn CLT, and the first time, I was exposed to any compression is during the CLT, during the certification, that you have kind of like, 2 half days, and all these companies come and talk about compression A, compression B, compression C, and you walk out of there and you're like, I have no idea.
Yep. Exactly.
Too much information. So in the beginning, it's like,
Yep.
let me just see how I can just manage with these techniques I learned, and then try to add on top of that what I already knew as a manual therapist in the ortho world. So how can I just put all this together? But usually compression was the last thing, right? So it was never my center of attention until you see this more and more and more, and then you realize how important it is from the beginning. Because as I always tell patients, 50% of any lymphedema treatment, you have 50% compression, 50% your manual lymphatic drainage, or any other manual techniques or modalities that you use out there. So without the compression, it's not really a success outcome. So
Correct.
how do you feel that really your experience kind of triggered into that compression therapy?
Yeah, so I mean, my patients shaped everything, right? So I saw firsthand how life-changing the right compression can be, right? Because we've all seen, or maybe most of us listening have seen, what the wrong kind of compression can do. It can cause tourniquets, it can cause wounds potentially, it can cause the fluid to rebuild. So whether it was reducing swelling after breast cancer treatment or just helping someone manage their lymphedema chronically, I was exactly like you, right? I had so many different vendors. I didn't know where to go and who to choose when I came out of CLT's certification. And so these gaps kind of inspired me to get more involved and try to dig and learn. My previous medical advisor with JOBST was able to teach me a lot about the proper fit, but also just having confidence in selling your patients. So you said earlier too, like maybe PTs or OTs don't really have the skill set of sales. I would actually disagree with you, because as lymphedema therapists, we have to sell our patients on lymphedema therapy, which is extremely hard to do if you're doing it correctly, right? 4 to 5 times a week of bandaging, MLD, that's a huge thing to have to commit to. And patients can, for various reasons, right? They can't commit to that. So after figuring that out and having to become a salesman in the healthcare world of why CDT, or complete decongestive therapy, is correct, why you have to get the buy-in from your patient for compression, because you want the good outcomes for your patients. And if you do not have the proper compression, you will not have the right outcome for your patients long term. Now, you may be okay for the first few months, maybe even the first few years, but eventually you're going to want compression. You're going to want your lymphatic system supported. And so that's kind of how my interest in compression kind of shaped being an OT-CLT, was that I just saw how important it was for chronic management of lymphedema.
And how about your OT background? Because again, if you want to explain a little bit, sometimes I have patients who tell me, well, what is the difference between a physical therapy and occupational therapy? So maybe we can start with like what is an OT means, and then how, what is that background help you even better to understand this fitting concept, right? Or how to measure, or how to cut, or how to do everything that you need to do to get somebody in the right garment.
Yeah. So to answer your first question, the difference between OTs and PTs, Right. And lymphedema care, a lot of us are doing almost the exact same things, right? But to me, OT is all about function. So not saying that PTs don't work on function. That's a hot topic, right? But that perspective of working on activities of daily living, that kind of never leaves you. Even if you're doing manual therapy all day long, you're still kind of absorbing your first background and love of getting people back to returning to work or caring for kids or feeling confident in their body, right? That's kind of the holistic approach that OT tries to encompass. And so I approach compression not just as like a medical device, but as a tool to help someone live their life more fully. And I think that's a really beautiful part of this job is that I get, complaints of how am I gonna live, right? I have to wear compression, but how is this gonna fit into my daily routine? And is this gonna ruin my life? And being able to offer different solutions, and maybe it's not always the perfect solution, but it's something that's catered to that patient is just it's a really nice way to help people and to get them to a place where the lymphedema isn't ruling their life. It's something that they can kind of control and have a little bit of say in their care, right? But also OT kind of trained me to look at the whole picture, right? So I'm even today not really treating, but I'm still talking to patients and therapists, and I'm asking questions like, how is the patient's cognition? How's the environment at home? What are your habits? Are you working out? Are you active? How are we dealing with our cancer diagnosis? Are we emotionally in a place where we're ready to accept compression? What are our physical limitations, right? That all comes into play when deciding what type of compression to use on a patient. And so all of that kind of influences how successful someone will be with a garment. And then it helps guide me and helps me guide the clinicians towards solutions that a patient can kind of realistically manage.
That's a very good point. I really like that. I think that it's important to know where are they at for this information, and it's overwhelming, right? Because sometimes I'm in the situation where I can actually see it in the beginning of it. So when we have a fortune to have a great prospective surveillance for breast-related lymphedema program, so we can catch it so early that we can avoid to go there. So we can just have maybe some compression for just a few weeks, and then you don't have to use it anymore because everything is good. So totally, we don't get to see as much the chronic lymphedema stage 3-4 we used to see in the past, because how physician has been really improving their surgical techniques and really make sure that they don't have to do full axillary dissections if they don't have to, and radiation being escalated, and so many more things happening with treatments in cancer in general that locally we don't have to be worried as much about it how it used to be in the past.
Right.
I'm so overwhelmed that sometimes you're right when you tell them we're in Florida and you have to wear a compression and it's already hot outside, like how I'm supposed to be doing this, and how I'm supposed to be working on the yard, or how I can go on the beach, or be in the pool and doing all those things that we like to do in a warm weather. And we're looking at 6 months out of the year to being warm, right? So it's not just like 2 months. So that's a good point to see where are they, where are they at, and are they ready for it?
Yeah. And, I think you make some great points too, just of, I've seen the spectrum, right? So one of my first patients I ever treated was a mastectomy patient from the late 50s, which is aging me a little bit, but she actually got an amputation from her lymphedema. That's how they treated it back then, or how her doctor decided to treat it. So she had an above elbow amputation because of her lymphedema. And unfortunately, it didn't solve her lymphedema. She still, in her residual limb, had lymphedema. So can you imagine how far we've come today with things like, prophylactic lymphovenous bypass procedures and lympha procedures, and really having surgeons take time in the axilla to preserve the lymphatics, which, like you said, is definitely reducing the amount of lymphedema we're seeing in oncology, which is amazing. But unfortunately, you're always going to have a little bit of the population that experiences it. But just to see how far it's come, right? We're not amputating people anymore. So that's really lovely.
The first time I heard of this. So locally, I have not been coming across that, thank God. So for clinicians who may not be as familiar, can you explain the basics of compression therapy and how it supports conditions like lymphedema?
Yeah. So compression therapy basically applies controlled pressure to help move lymphatic fluid out of the tissues and supports the lymphatic system as a whole. So in oncology, when we're removing lymph nodes, sometimes our lymph system becomes impaired or overwhelmed. And then compression becomes essential because it acts as kind of a band-aid or an assisted device to the lymphatic system. And it helps not only reduce swelling, but it helps prevent that fluid from reaccumulating and helps improve overall circulation. It helps even with skin texture. So for many patients, it's kind of that lifelong management tool that helps keep symptoms stable. And I'll say from an OT perspective, even if you don't have chronic lymphedema, if you have heaviness or achiness, after a lymph node removal, compression, even if there's no signs uh, of swelling, can be something that helps that heaviness and achiness when it's fitted correctly. So it doesn't have to be something that is a jail sentence, right? We're using this as a tool in our toolbox, along with other things like self-manual lymphatic drainage. Sometimes we'll use pneumatic compression pumps. Sometimes we're using, hopefully everyone's using exercise and that muscle pump to get your fluid moving throughout your limbs. But compression therapy is just such a great tool to have at your disposal. And there's so many different types now in the market to be able to fit every patient that, you'd really be doing your patients a disadvantage to not have the knowledge and not be able to at least talk a brief amount about the importance of it. But I think in general, therapists, myself included, can get overwhelmed. Like you said, you come out of CLT certification and every vendor's there and you don't know where to turn. And, you certainly aren't taught it. The mechanics of compression during school or during your certification class is kind of something that's a learned on the job type knowledge. For compression itself, it's just something that I am so passionate that therapists have this baseline knowledge and why it's so important to be able to educate their patients on the importance of it for management, to keep them out of the clinic, to keep them healthy. So yeah, long-winded answer of why it's important for so many reasons, but that's kind of the overall arching view of it.
I got you. What are the most common mistakes clinicians or patients make when using compression garments?
Yeah, so I'm usually, if you're in any of my classes, we classes throughout the whole Southeast region, 4-hour, 8-hour classes where we're teaching clinicians about compression. But if you're ever in one of my classes, I'm usually the first to say that I've made every mistake. So and I still work for the company. So don't feel like you can't make mistakes when you're recommending, as long as you're not hurting anyone. If you recommend the wrong fabric or the wrong, configuration of a garment, everything is generally fixable. But I will say a few big ones are going to be incorrect sizing and incorrectly measuring. So that really comes down to ready to wear products, right? Things that you can just order very quickly that have a size chart versus what really most patients should be in, which is custom, made to measure to your own specific measurement. And so I think, myself included, a lot of therapists want to try to get their patients into ready to wear because one, it's quicker to get, right? And there's a lot less measuring that's involved. It's a little bit easier of a process just to pick a size and move on and get it quickly, right? I see the value in that. But I think the biggest mistake that I see is that clinicians are recommending ready to wear when their patients should really be in a custom made garment for them because the fabric's different. So usually with ready to wear fabrics, I'll just say with like a basic stocking that you're going to see at CVS or on Amazon, it's going to be that thinner fabric, right? And what happens with that thinner fabric is that we call it circular knit, but it will dig into skin folds and potentially cause a wound. And it's just honestly very uncomfortable. It's kind of a Yeah, it's hard to wrap your brain around because you see the thinner fabric and you think, oh, that's definitely going to be more breathable. That's definitely going to be more comfortable than something slightly thicker. But it's actually the opposite. For most lymphedema patients, we actually want a very slightly thicker material called flat knit because it bridges skin folds and it also provides that high containment that lymphedema patients require. So I would say that's kind of like what I see on a regular basis that can actually hurt patients is not picking the correct fabrics, not picking, the right ready to wear versus custom, which is almost impossible to know right out the gate. But that's why we're here as part of your JOBST support team to kind of help you through that process and learning. But I also see just skipping education too with patients. And I would say 9 times out of 10, my clinicians are amazing and they're going above and beyond for their patients. But usually, if they're getting it through a CLT, they're getting such wonderful information. But some patients don't have a therapist, right? And they're getting their education through other people who maybe aren't healthcare providers. And so those patients really have to understand how to don the garments. They have to understand the why behind wearing compression. The donning and the doffing is really important because if they can't put it on, then they won't wear it, right? And if they can't take it off, then that's a big problem. So I see that a lot too of just addressing the issues of donning and doffing and working through with the patients. And then I would say the last thing is probably expecting one garment to solve everything. So that's just unfortunately a little bit of a pipe dream. Luckily, JOBST has the big players in your daily management. So we have adjustable Velcro wraps, our Farrah wraps. We have night garments. We have day garments. We have donning and doffing aids. So really figuring out with your patient what is going to work best out of that toolkit and then figuring out what to order can take up a whole treatment session, honestly. So I always use my time when I was doing manual lymphatic drainage with patients of just talking about compression and the importance of compression and educating them on why they needed it. So we would avoid hopefully some of the mistakes that they would have down the road so that they just heard my voice in their head when they were using their compression down the line. Yeah. So.
And again, for the clinicians out there that are listening to this, again, they've been great. Like, and I can really reach out to Jocelyn, and it's like, I have this patient with this condition. What can we do? And they're like always willing to come and, let's look at the patient together. Let's see what options we have for garments. Because at the end of the day, you guys are the experts on it.
100%.
Exactly. I know exactly when to start with, maybe with a circular net versus it's time to change into a flat net, or no, we got to start in a flat net right away. And when to use a night garment, when to use a reduced kit, all those kind of things are really has been super helpful.
Yeah.
What should therapists consider when selecting the right compression garment? I know you already mentioned a little bit of that, but if I have a patient who comes in and a star, for example, is they have a mastectomy, an axillary dissection, come back 3 months later for like a surveillance protocol, like, looking into what's happening. And they come in and it's like, I have noticed some swelling on my arm. I definitely cannot see my rings any longer. I feel some tightness on my arm. And then we do a bioimpedance and we do volumetrics and everything matched that they actually start developing lymphedema. But you have this tissue that is still pretty soft still. What will be your first garment recommendation at that point?
Yeah, so I mean, to go back to what I said earlier, right, between the circular knit, the thinner fabrics, and the flat knit, there are instances when circular knit is completely fine, right? But for most people and most Americans, the body shapes that we see, the size chart can only do so much if we have a body shape that doesn't fit into a size chart. And doesn't matter if they really don't have palpable swelling, then we would still need to do a custom garment, right? Because we don't want to tourniquet the tissue. But I would say to answer kind of your question as a normal shaped limb, circular knit can certainly be a great place to start. But as time goes on, hopefully that would even prevent the lymphedema, right? And prospective surveillance is one of my favorite topics. And I know a lot of the clinicians out there love it as well, because you can really prevent the lymphedema from happening if you can find very early these small tracings of fluid and try to stop it with exercise or with a compression therapy or with maybe some light manual lymphatic drainage, and really hopefully reverse that from ever getting to a point where you're needing to wear compression daily. But it's a spectrum, right? And certainly, I wouldn't want somebody to just immediately order something on Amazon without even looking at a size chart to know that maybe their upper arm is too big for that garment and their tiny wrist is not fitting within that size chart. So I think people just don't understand a lot of the times the importance of not of making sure you're fitting correctly into that size chart, because that's where you find things like you'll see patients with puffy hands after a circular knit sleeve starts to dig right into that ulnar styloid area and starts to kind of cut off that lymphatic fluid once it's so tight. All therapists have probably seen somebody come in with that. So we definitely want to avoid things like that. We don't want the compression to make things worse. So sometimes starting with a nicer garment is actually the way to go, instead of just always starting somebody in circular knit. Certainly if there's no swelling, then we can always start on the thinner side of the spectrum. But I think it really certainly depends on the diagnosis, the stage of swelling, and every patient is so different.
How do you help clinicians improve patient adherence to wearing compression garments? Because this is a big part of it. It's like you have, as we know, when you have patients with chronic lymphedema, that gets more complicated, right? Because we much know patients get tired, and I get them, right? It's like day in, day out for years and years of, and then money spent in garments after garments, and then they just get tired and they stop doing it. So their swelling gets worse, so they don't fit in the garments any longer. What tips do you give us to improve that adherence?
Yeah, so that's definitely, compression fatigue we want to try to avoid, right? So education is huge. So first of all, providing realistic expectations about what compression can do, right? Because compression is a tool in the toolbox and can certainly be one of the most important tools in the toolbox of managing your lymphedema, but it's not going to be the end all be all fix or cure to your lymphedema, right? So first off, we need to provide those realistic expectations to patients, because it's not going to be something that you're sometimes even able to just throw on like a sock, depending on the severity of the lymphedema, right? Like sometimes it's going to take a couple minutes to get your compression on, but once it's on, it should fit like a glove. And the one thing I would say about working for JOBST, at least, is we have a satisfaction guarantee. We try to get every patient to a point where they have that 100% satisfaction with their garments. So we offer remakes for our custom garments within that 45 days once it's delivered. If something's not fitting right, I always say you want to make sure that your patient is washing the garment. So people are afraid to wash, right? When they get their custom garments, they think, oh, I can't wash it because I can't return it, right? It's actually the opposite. We want you to break in these garments like you would a pair of hiking boots. So that's something I learned from Gunter Close, who's one of the certification school instructors who's taught me quite a bit, is that you have to treat these garments like you would a pair of high heels or hiking boots that you have to break in. So it's not always, something that you're going to slip on and it's going to feel perfect. So I think that expectation is really hard for people to grasp, right? But I also think with the Lymphedema Treatment Act, which came out, early last year, we have so much more access now to compression garments. So Medicare patients now get 3 daytime garments every 6 months and then 2 night garments every 2 years. They can get their bandages per medical necessity, as well as the donning and doffing aids. So that's a huge change that's happened. So I think just educating patients that there's more coverage now than there was even just a couple years ago. So they can get things now like night garments. Night garments before used to be something that, would be a last ditch effort because they were expensive and there was very little coverage for patients, right? I'm sure you have had this conversation many times, but the research coming out is more and more early intervention with night garments can really be the game changer for making sure that your lymphedema doesn't progress. And I always, think about myself, right? Like if I needed to wear something all day, every day, I think I would be the worst patient, first of all. And I would try to, cut corners as much as I could, right? Just like any of the clinicians out there, like sometimes we're the worst ones about taking care of ourselves, but I would want something to put on at night if I wanted to, go out to dinner or go to an event or, just be without it for a few hours and feel, quote unquote normal. I mean, I wouldn't want to wait 12 hours to put my daytime garment back on. I would want something for nighttime that's maybe
Yeah.
quilted, more comfy and
Yeah.
can help me, not refill overnight. So just being able to have that conversation with patients that there are, it's again, not a jail sentence. We have ways to manage it and addressing the emotional concerns of the patient, things like that, or cosmetic concerns can really improve adherence, right? Just listening to patients and what's important to them, can help them just feel confident about using their garments. And then your adherence goes way up, hopefully.
Yeah, and you brought a really good points. One thing that you say about washing the garments, a lot of patients come across is like drying it. So it's a lot of controversy between they're like, oh, I just hang it up because I don't want anything to happen to that. Like, oh, some others like, no, you want to put it on the dryer because you want actually that, like, that kind of elasticity to kind of like become a little bit more stronger. So what is your opinion on that?
Well, it depends on the fabric. At least with all of our garments, you usually there does, you have washing instructions with your garment that's coming in, but I would say most, let's just say flat knit fabrics, you actually can just throw in the wash. I recommend washing solution that doesn't have a lot of fragrance to it, and I like to use like the Tide Free or things of that nature that aren't gonna synthetically kind of mess with the fabric structure. But you can just throw it in the wash. And then as far as drying, most of them are lay flat to dry, so I would advise against hanging it because the weight of gravity could maybe stretch it, and we really are hoping, at least if it's a custom garment, that that length is preserved. But like you said, if you're between garments and you can't get a new one and yours is getting stretched out, then I've definitely heard of people throwing it in the dryer. I don't know if I can actually recommend that officially, but laying flat to dry is kind of what most of the flat knits are meant for. Yeah, but it just really depends on the fabric.
So on the circular nets, that will be like,
I would still lay flat to dry. I mean,
okay.
yeah, again, you don't want to stretch it, but the circular knits will wear out a lot quicker than the flat knits. I'm sure, you've seen that. You get holes in them easier. You can poke a hole with your nail a lot easier with the circular net ready to wear. So I would maybe put those in like a garment bag or something
Yeah.
to protect them in the wash versus a flat knit you should be able to, in theory, just throw in.
Okay. How do you see compression therapy evolving in oncology and lymphedema care?
That's such a vast question. We could probably talk an hour. But yeah, I mean, so my hope, just from working behind the scenes, smaller clinics, bigger clinics, is that one can get a code for measuring for compression. Because as of right now, there really isn't a specific code for that. Now there are ways to include it, right? For the OTs and PTs listening, there's education that you can provide. There's ways to include it in your untimed eval charges without getting too deep into that. I would say that would be the number one thing, is just allowing OTs and PTs to bill for their time for measuring for custom would be first and foremost one of my things that I would want to lobby for if I could. But from a patient perspective, I would say, we're already seeing earlier intervention, right? We have things like ImpediMed has a SOZO machine, and that's really wonderful and can detect earlier. But with compression, like including that into the type of prevention conversation that we're talking about. But really personalized care, I think educating just regular nursing staff or even just the people who you're encountering about the importance of it, and the importance of it fitting right. I think continuing to educate, we'll see that integration of compression into holistic survivorship programs. So, hopefully most of the credentialed cancer centers around the nation are doing survivorship programs, but I think compression can really be a key part of that. So hopefully that would just help kind of evolve the conversation about compression and the importance of it, and kind of reduce hopefully the stigma of compression, that it's not as scary as you think it is, and it can really be a tool to help you even if you don't have chronic lymphedema to feel better.
Right. Are there any new technologies or innovations that excite you in compression garments that excite you?
Yes. So again, a topic I could probably talk a long time about, but I think the trend just in the future is going to be materials that are more breathable, softer, durable. I know our confidence fabric is extremely breathable. And it's something that, I can wear, and it's going to wick that sweat away from me, but it's not going to create like a wet garment, right? When we're working out or we're exercising, we're doing our lymphatic drainage exercises, that we can offer materials to patients that are breathable and soft and also more durable, right? We always want our garments to be able to last a long time. And so JOBST does a great job of reminding patients on when it's time to reorder. But I think we also try to pride ourselves in hopefully offering solutions to patients that are going to last them, that 6 months until they can get a new pair. That's something that we try to honor, is if there's an issue with the garment, that we fix it. I also think just kind of smart design elements, we have our Ferro wraps that, can help improve that adherence rate. Things like our Ferro 4000 has an inner liner to it, or our Ferro light arm sleeve has an inner liner to it. So you can just slide that arm right in. Things that help patients make it easier to don. I think we're going to see a lot more of that. And my goal always, one of my favorite parts of like the whole toolkit altogether is going to be night garments. And I think we're just going to continue to see innovations to the importance of night. Specifically, I love our Relax garment. It is very breathable and it's one of the thinnest on the market. So I know a lot of patients that really just rely on that quilted fabric for comfort. And so I think investing in nighttime, investing in personalized patient solutions, we're going to just continue to see more of that as time goes on.
Okay. And to wrap up, if a clinician listens today and wants to improve their lymphedema or compression practice, what's one step they can take this week?
One step. Okay. So one step would be to, one, have me on speed dial if you're in my area, right? Because there's not just one step. So I would say having your support team in place, right? If you made me choose one thing, have a phone a friend, whether it's myself as your medical advisor or a trusted CLT that you can call. We're a wealth of knowledge, right? And you guys really, as treating clinicians today, are a wealth of knowledge. You're the ones that know your patients the best. But to expand on that, if you give me maybe a little bit more, I would say revisiting just the importance of helping your patients figure out the fabrics and your measure, like helping them with measuring for the right and proper fabric and garment, I think would be the foundation of effective compression. Those two things, I would say revisit maybe on jobstcompressioninstitute.com. We have all of our order forms. So taking a look on there and visiting, maybe looking at some videos or looking at our order forms to see how tight to pull in certain areas. And when you're completely lost, then phone a friend, and I'm here hopefully to pick up your call and help you in the moment as best I can.
Excellent. And I for sure will put all your contact information on the show notes so the audience can get a hold of you. So
Yep.
it has been an amazing educational conversation. Thank you so much, Jocelyn, for being part of the show.
Yeah, it's an honor. I've been listening to this, and I know I've been bugging you about it and just telling you how much I just appreciate you doing this. I know the patients and clinicians that listen to you are getting a lot out of it, and I just appreciate you for putting this out there and working on it on a regular basis.
Thank you so much. I'm enjoying it.
Yeah, great.
All right. Well, you take care, my dear, and hopefully we'll see you soon.
Okay, have a good one.
You too. Bye.
Bye.
Thank you so much for listening to the latest episode of Taking Charge of My Cancer podcast. If you have not already, feel free to share this with more people so they can benefit from this information. If you would like to connect with me, see the information on the podcast description. See you later.